Good morning and welcome. My name's Rachel Browner. I am the program coordinator for OneOp, and it's my pleasure to welcome you to today's session on Medicaid's role in military family well-being and economic security. In case you're joining us for the first time, I'd like to give a brief tour of our webinar platform so you can find your way around. Hopefully, you're currently able to view the slides we're sharing. If you're unable to see them or if you have any other difficulties, please email us at contact@oneop.org for tech support. And at this time, if we could have you start going ahead and utilizing the chat box. We'd like to get to know you a little bit better, makes it a little bit more personable. So if you let us know maybe who you are, where you're joining us from, to embed that chat pod so you don't miss any links or conversations, simply place your cursor over those shared slides. You'll see a toolbar pop up across the bottom of your screen, and from there, just click that chat bubble icon. And when typing questions or comments, please be sure to select that everyone option from the response option drop-down menu. So everyone's able to view your response in the chat. So it looks like we have a good group of folks that are already posting. So we see some folks from San Diego, Oklahoma, Alaska. Thanks, Macon, for joining us. Virginia Beach. So we got some folks from the East and West Coast. So welcome. Note that the slides and resources are available for download on the event page for today's session. And we're going to be covering CEs or continuing education information at the end of the webinar. So please stay tuned at the end if you are interested in receiving continuing education credit or a certificate of attendance. Stay tuned for that information at the very end today of the webinar. And finally, closed captioning is available for this webinar, so you can turn on the subtitles via the Zoom toolbar if you need it. And my colleague Coral has posted a link to the webinar slides and resources that are on the event page in that chat box. Again, thank you for joining us. We want to thank you as we continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand that readiness, knowledge, and networks of professionals supporting our military service members and their families. At this time, I'd like to briefly introduce our presenter for today. Dr. Christopher Pline is a professor in public administration and an Eberly Family Professor for Outstanding Public Service Emeritus at West Virginia University. So Dr. Pline is recently retired. He has worked with OneOp in different capacities, and so he's not new to this platform. His name may be very familiar for those of you that are returning for OneOp webinars, as he focuses a lot on Medicare and healthcare information. His academic research on health and social policy has been published in such journals as Health Affairs, the Journal of Health and Human Services Administration, and the Journal of Healthcare for the Poor and Uninsured. His expertise on Medicaid and health policy has led to invited presentations at the state and national level, presentations to the West Virginia legislature, and interviews with state and national media. And as I mentioned again, he's part of our OneOp team as well. So without further ado, Dr. Pline, I'm going to let you go ahead and take over the presenter reins at this time.
Rachel, thank you so very much. And it's just great to see so many people here from across the country joining us today for this webinar. And, you know, one of the nice things about the OneOp project is that we do draw folks from across the country and from outside the United States to listen to what we have to say. This particular webinar, focusing on Medicaid, really makes where you live a very important aspect or dynamic to what we're going to talk about today, because as we're going to learn throughout the hour that we have together, Medicaid varies from state to state. So if you are in Utah, or if you're in Ohio, or Alaska, Texas, New York, you're going to see variations on Medicaid in each of those states. And I know that so many of you who are here with us today are in the profession, they're in the vocation, they're in the job and responsibility of helping families navigate different processes, different policies, different systems, both within their own state, but also as they move or transition or PCS to other states. So if one of the big takeaways today one of the big takeaways to remember today, I think, will be this variation amongst the states as we talk about Medicaid. So welcome, and it's great to see folks from all across the country, and I'm really interested in hearing some of your perspective as we go forward. So I'm going to advance the slides, and oftentimes we just go right through the title of a slide and just get into the substance of things. But I actually want to ask you all a question as we get started today, and that is, what do you think Medicaid's role is in military family well-being and security? And I'm a teacher for many years. I just love to hear conversations and discussion. And so, if you wouldn't mind, if some folks might like to reflect on what they think Medicaid's role is in military family well-being and security, and I think that will help us, have a little bit of conversation going forward. Anybody want to offer an idea? Oh, wonderful. So Denise is noting that it's assist when TRICARE doesn't support. Absolutely. So one of the things we're going to talk briefly about today is this relationship that TRICARE has to Medicaid. It's one of a number of federal health benefit programs that actually has dual eligibility with Medicaid. There's a couple of other ideas I want us to carry forward today, and that is that Medicaid and TRICARE have both a concurrent relationship where at times people may be getting both the TRICARE and the Medicaid benefit, but increasingly it's a continuous process of where people are moving from TRICARE to Medicaid, perhaps as they transition or separate from service. And so, yes, this idea of filling the gap between military-related benefits, absolutely, whether it's concurrently or whether it's consecutively. As Kristen has noted, it's good to see you, Kristen, that benefits can help to offset the cost of healthcare, freeing up resources for other basic needs. Absolutely. So again, we're not talking specifically only about Medicaid and its relationship to health. We're talking about family well-being and security. It provides families, as Sonia is saying, with services and access to services that require Medicaid, such as respite care. These are all really helpful. So let me ask you another quick question. Who does Medicaid serve? And would love to hear. And Tia, this is great, Denise, and others have said, so one Tia notes, and that's kind of a bridge to what we were talking about, is that it does help those who have ongoing disabilities, to our dependents, to U.S. citizens. Absolutely. Okay. If we think about Medicaid, and this is another thing that I want to impart today, is that Medicaid, and I've taught courses on Medicaid over the years, and I've talked to my students about this. Medicaid essentially serves all of us. It serves us if we need to have a Medicaid benefit because perhaps we're disabled, or we're older in long-term care, or we are a low-income individual who is working and is eligible for Medicaid. So it can help us directly if we have a healthcare need, if we are economically eligible for it. It helps us as caregivers, as we're taking care of loved ones who may need Medicaid services. Oftentimes, this might be an older family member who is in long-term care, and Medicaid is helping to provide for their support. It's also just for all of us in general. Many of us have probably heard about things like home and community-based services, or a home health person coming in to help a loved one. Well, in many ways, Medicaid has been the model and framework for that. And so innovations in Medicaid 10, 20, 30 years ago have really helped to shape the way that we deliver long-term care in the United States. Many of us, for better or worse, are familiar with managed care, and where our care is coordinated by case managers. There's a pre-authorization process where we go through a primary care provider, things such as that. Medicaid was actually was a pioneer in that. And so a lot of the health models that we have today, whether it's home and community-based services, taking care of elderly folks or those folks with special health care needs, who might otherwise be in a nursing facility or a long-term care facility, receiving those services at home, is in part a reflection of innovations that Medicaid helped to push forward in recent memory. And the same goes with managed care, the way that we organize and deliver healthcare. So in many ways, Medicaid touches all of us, either directly because we are eligible for it and we need to utilize the services. As a caregiver, as we utilize this to help us in our efforts to provide care for those that we love and cherish, and as citizens in general, as we encounter healthcare in our society. So thank you so much for these introductory observations, really helpful. So a little bit of background. You know, we are started on this particular, over the next 6 weeks or so, we are engaged in what's called the Military Family Readiness Academy. And as we pursue our study of this, and you all are invited, of course, to sign up for the MFRA courses and to attend the various webinars in support of this, is that we realize that military family readiness is absolutely crucial to force readiness, to family well-being, to helping individuals across their life cycle. And so when we think about Medicaid, Medicaid is one resource in our toolbox that we can utilize to assist families as they navigate their life journey. And as individuals seek to address various challenges to health and their well-being, Medicaid is one such program. Many of you probably know it's a joint federal-state program that has been providing healthcare access and coverage for millions of Americans, including military families, since 1965. So it's an important resource that we can tap into, especially as families think about their life journey moving forward and separating and transitioning from the military, but also while in service. I want to emphasize that as well. If we think about it, it's part of the toolbox that those trusted intermediaries like you have to assist families accessing resources. And so much of what we want to do today is we want to talk about this resource and to help to empower you in terms of understanding the contours, the complexities, the strengths, and the limitations of Medicaid, to talk about how Medicaid and TRICARE relate to each other, both concurrently, where at times people may be using both benefits at once, but also consecutively, where individuals might be receiving TRICARE benefits as, say, active duty service members or with their families, and then as they transition or separate from the military, turn to Medicaid for needed support. We also want to talk about a really important theme that's undergirding a lot of force readiness, military family readiness, and general perspectives towards health and well-being in our society. And that is looking at what are called the social determinants or the social drivers of health. I cannot stress enough how much this new paradigm or worldview, which actually is quite familiar to all of us, it's very commonsensical, it's about connecting some dots about causes and effect, has really helped to shape the way Medicaid is moving forward. Medicaid covers around 80 million people in the United States. And so if you think about the fact that we have a little over 300 million people in our country, that's quite a bit. Now, we started off today talking about how Medicaid varies from state to state, and it also varies in terms of the percentage of the population that's covered. In my home state of West Virginia, about 1 out of every 5 people is covered by Medicaid, and that's not unusual. Okay, and so uh, Medicaid enrollment varies from state to state due to eligibility criteria and other policy factors. The citation that I have here with Rudowitz et al. Is from a report called Medicaid 101 that's been recently published by the Kaiser Family Foundation, and we have it listed in the resource page. If you would like to have a really nice, concise, readable overview of what's happening in Medicaid, I encourage you to take a look at the resource. And indeed, it's part of the series of Health Policy 101 reports that the Kaiser Family Foundation has recently produced on lots of different things, including Medicare and insurance in general. But Medicaid is jointly funded by the states and the federal government. But here's the thing, Medicaid is state administered under federal guidelines. I can't impress upon all of us the importance of this because each state has its own approach to Medicaid while at the same time adhering to certain federal standards. The variation amongst the states has some real implications for our military community. One, it means that services that you get in one state, say New York, may not be available in another state, say West Virginia or Texas. It also means that some states will manage their Medicaid programs centrally, like at the state level, such as in West Virginia, while other states, like New York, tend to manage their programs at the local level. And so there's a lot of variation, and we really need to keep that in mind. Here's the other thing. Because Medicaid was set up as a state-administered program, and it was originally designed in 1965, and it was actually just an addendum to the Medicare Act, which I think we're all familiar with, Medicare, which is a federal program, uniform across the country with some variation, but basically uniform across the country. That when Medicaid was created, it was really anticipated that it would be a state-centric program. And what I mean by that is that it would primarily be intended for folks who were residents of those states who had to satisfy residential or residency requirements to enroll. Because of that, Medicaid really did not lend itself to populations who were highly mobile. And of course, we know that one of the most mobile populations that we have because of their service to the country is our military community. So Medicaid has at times created walls or barriers to participation based upon residency requirements. And as probably a number of you know, this has been a challenge for military families, say in the PCS process, where perhaps they were having their TRICARE benefits supplemented by Medicaid, say with a waiver program for home and community-based services, and then facing the PCS of moving to another state and not being able to access those services. That is a very big part of the challenges that we all face, and I think many of us are familiar with as in that commitment that you all have to helping families navigate their military life journey. Oops, I went ahead too quickly. Okay, so just a little bit more about Medicaid basics. And again, this almost this kind of summarizes what I was just talking about. But oftentimes in our work, in your work, I should say, we think about Medicaid in terms of home and community-based services. And these are programs that are vital for families needing long-term care or specific health support for family members who have special care needs. Now, I want to emphasize something. Oftentimes we frame this or we think about this in terms of youngsters, of children who need this, and that's absolutely the case. But we also know that many adult family members, dependents, also may need home and community-based services. And so those of you, for example, who I know are online here who work in EFMP, know that when you work with military families, and for those who are in the EFMP process, it's not only children, it's the adult, it may be adults as well. It's the whole family. Okay. And we realize that home and community-based services, which might include things like respite care, might include things like home health services, some therapies and things like that, that these become very, very important in helping to provide for the care of those family members who have special health care needs. What's happened with Medicaid is that over the last 20 or 30 years, as I was mentioning, Medicaid has allowed, the federal government has allowed state Medicaid programs to develop what are called waiver programs. These are state discretionary waiver programs which require federal approval. And the idea behind this is that the states have developed models to provide this home and community-based services for folks with special health care needs, long-term care needs, and et cetera. And what we have across the country is a patchwork of waiver programs. It's not a uniform set of programs. It's a patchwork of programs. And each state has its own approach, tailors the waiver programs to reflect their specific desires and actually the politics of the state as well. These waiver programs have become very important in providing healthcare services and to providing overall benefits for families. However, the demand for these programs has oftentimes outstripped their availability. And military families in particular may face real challenges with this because oftentimes it takes months, if not even years, to get access to some of these programs. And if one is PCSing or moving, they're going to have a difficult time achieving their residency, maintaining that residency, and being able to access this system. So many of you, I'm sure, are familiar with some of the challenges that are involved. And these are challenges, by the way, folks, faced by families who are, you know, kind of like they've stayed in place, they're in their own state, and they've been there, and they're not in the military for many, many months. I mean, so things like wait list, things like being able to access these services, these are problems that are endemic in many states for those long-term residents of the states because of the lack of availability. The problem becomes even more compounded for active duty military families who may be in a transition process through the PCS process, or maybe moving or leaving military service. So, if you will, imagine me as a director of a movie. And what we've done is we've done a close-up. We did a close-up on home and community-based services, and we did a close-up on Medicaid basics. Now, we are going to pull back. And Michelle, thank you so much for your comment in the chat box. Yes, waiting many years and having been a resident for many, many years. Let's pull back a little bit because what we want to talk about now is where is Medicaid sort of orienting itself at the national level, and how is this percolating out through the states? And one of the things that we're seeing is that Medicaid has long been focused on 3 dimensions of healthcare service and delivery. Obviously, treatment, right? Providing reimbursement for physicians and other healthcare providers who have provided treatment for a person who has Medicaid, the Medicaid health insurance benefit. Increasingly, there's also been a focus on prevention. How do we address the underlying causes, the underlying forces and factors that can contribute to poor health status? And so Medicaid has really been has put a big push on prevention, especially in the last few years. It's Medicaid, if you will, with a public health function. And as we know, public health is really about this notion of prevention and well-being and underlying and identifying and addressing underlying causes for poor health outcomes or health disparities. The other side of this is management, right? How do we provide management? And management can be managing care, but also can be managing long-term chronic conditions, okay? And we often know that individuals who have specific or special healthcare needs, if you will, that case management becomes very, very crucial. And so as we start to realize is that more emphasis is being placed on prevention and management, and this shows a shift to systematic health approaches considering life circumstances, health status, and socioeconomic and environmental factors. You know, this notion is wrapped up in what folks call the social determinants of health. And that is how different factors contribute to disparities in health risk, outcomes, and access to services. I want to tell you a story, if you don't mind. So Rachel just mentioned that I've retired recently. And so that means that, you know, I've been around for a while. And I'm going to tell a story that I think many of you can probably relate to. When my wife and I were first married, we were trying to find housing. We lived in a rural community in Virginia, not West Virginia, but Virginia. And we were trying to find housing. And it was really hard to find housing where we lived. And we found a little house to rent that was away from town and was, let's just say, you need a little bit of repair and upkeep. But the rent was really good, and it's what we could afford. And so we went to that house, and we looked around. Very, very small house, very small house. And my wife's father accompanied us, okay? So, you know, it's not always easy going someplace with your father-in-law for him to pass judgment, but he did. And he gave some really great life advice. And he said, kids, this place is affordable, but it's drafty, it's damp, it's moldy. It's going to make you sick if you live here. It's drafty. It's going to be hard to heat, which means that it's going to cost a lot in energy bills. It's far from town, which means that if you want to go to the doctor, if you want to go to the grocery store, you're going to have to drive. My father-in-law in 1983 was giving us advice that was predicated upon the social determinants of health, though he would not have known that, at least that phrase. But we all know that underlying factors can affect our well-being. And the long story short, we ended up finding an apartment closer to town, and we lived in that for a couple of years until we moved on in our life journey. So many of you have probably heard about the social determinants of health, and I want to spend some time talking about this because it really is helping us think about total force readiness in the military. It's helping us to think about, certainly about military family readiness and well-being. If you think about the recent National Defense Authorization Act, if you think about, look at some of the recent policy guidances, such as the Military Family Readiness System guidances, while they may not explicitly say the social determinants of health, they're really trying to address some of these factors. And these factors include economic stability, right? Not only for the service member and their career, but also in seeking to provide accommodation and support for spouses and for partners. It's recognizing the cost of housing, transportation, the need for recreation and other outlets that promote well-being. It's certainly about education, right? and our knowledge and our training, but also about our familiarity with healthcare. And that's where we, as researchers like myself, many of you who are helping professionals, helping families, that's a big role that we can play, is recognizing the educational level, the familiarity, the health literacy of those that we work with. Okay. Recently, the Department of Defense, and Rachel, I'm going to ask you, if you don't mind, to put this into the chat box. The Department of Defense and the Office of Special Needs publicized a survey that was just released on the EFMP program. And one of the findings in this is that families may not be fully aware of some of the health benefits that are available to them under TRICARE's Extended Healthcare Option Program. And so if you go through the surveys, you'll see information that, wow, people were not aware that, say, ECHO, yes, Denise, ECHO, thank you, had respite care options. People might not be aware unless that so many people in the EFMP program are not just kids, but they're adults. With those with special health care needs, it's a very wide range of need. And so I commend this report because it's a good self-assessment and evaluation of what is needed to begin to address or to capitalize and build on efforts that have been made to understand the causal factors, whether they're systemic factors about situation or health status, whether it's about folks' knowledge of programs that can help them navigate the life journey that they have with and without the military. So the social determinants of health really kind of remind us that there are a lot of factors that come into play. For my father-in-law, it was like, you got to live in the best place you can afford, because if not, there's going to be spillover effects. For those of us involved in the study and the practice of health systems and information referral to needed resources, it's understanding how these different pieces come together. Take, for example, community and social context, or the healthcare system, those two columns over there on the far right of this slide. Think about those families that you've worked with at the installation level, where mutual support is so important for their well-being, where being integrated, having a sense of community, being involved is so important. Think about those circumstances where a family is facing stress and how that can have an impact on their financial, economic, and health well-being. And these are community and social context factors that we all have a role to play in identifying and help families navigate and address. Let's think about the healthcare system itself. Think about the complexities of TRICARE. Think about the complexities of Medicaid. Understanding how these systems work and helping others understand how these systems work can help take these potential challenges and turn them to advantage. Okay, and so, for example, last week, and Rachel, if you don't mind populating the chat pod with this, we had a very helpful webinar on the Autism Demonstration Project. And I think that was a really good example of where information could be shared with families, information could be shared with military family readiness personnel and other helping professionals, highlighting the different steps, the different stages, the different processes that are involved in understanding how families can access this service and move forward with it. So I've spent a bit of time on this because I think it's really important for us to think about how social determinants of health influence the work that we do and influence policy. And you may be more comfortable of using the phrase social determinants of well-being, because we think about it, all these factors affect well-being, whether it's health outcomes, uh, economic outcomes, what have you. So again, this is just a quick summary slide, and it talks about how the model considers these social, economic, and environmental factors. It's widely adopted, including by the Centers for Disease Control. The table that I just shared with you is from 2018, also from the Kaiser Family Foundation, which is a really nice summary of this. But the paradigm shapes approaches to military family readiness, and I think it has influenced policies and programs. It may not be expressly stated in a lot of policy guidances, but think about this in the work that you do. You really are thinking about these underlying factors that can contribute to family security. You think about health outcomes and how to promote positive health outcomes and how to prevent those that are negative. Medicaid, as a federal and in many state levels, have started to recognize this and trying to incorporate this SDOH perspective into program design and implementation. So again, think about, again, I keep saying that I feel like I'm a director of a movie and I'm going from scene to scene. So maybe I'm thinking about my encore career now that I've retired. But if we think about it, that was a joke, everybody. If you think about it, Medicaid in the military life cycle, and this is another thing that I think it's important for us to review, okay? One, TRICARE and programs like the Extended Health Care Health Option, ECHO, they provide coverage for most active duty military families. And we're focused on active duty military families today in our presentation. But there may be times where Medicaid is needed to augment or to supplement those services. And so this relationship between TRICARE and Medicaid is complex. Ideally, the ECHO program can substitute for Medicaid because ECHO, of course, is portable, can go from state to state, is set up ideally to address these. However, there are still friction points in the system, which I think many of us recognize. I'd like to focus today also, though, on Medicaid for those leaving military service. Medicaid can be essential, especially for families with special care needs or limited income. Now, we know that most military families transition out of the military. We also know that in recent years, with force size and changes in force size dynamics, the importance of retaining and supporting families throughout their career journey. And so for those of you who will be able to participate in the Military Family Readiness Academy, there's going to be a number of learning opportunities that center and focus around these important touch points or transition points in life. And separation from the military, retirement from the military is one of those. And so we know that in family readiness, it's not only about enlistment and people projecting through their careers, but it's also about assisting those as they make the transition out of the military. And for those leaving the military service, especially if they have family members who have specific healthcare needs, or they may leave the service and have limited income, working, mind you, but limited income, that Medicaid might be an important pathway after they leave military service. And we know that we have an obligation in military family readiness in helping with a warm handoff, if you will, to the civilian world. Medicaid is also vital for many families facing long-term care decisions as loved ones age or need support. As early as 2014, According to the Center for Medicare and Medicaid Services, over 50%, over 50% of all Medicaid cost in the United States. And currently, Medicaid's about 1/6 of all healthcare costs in the United States. Over 50% was directed to long-term care, whether in a home and community-based setting or whether in a long-term care facility, or what we've traditionally have called nursing homes, but really residential facilities. And so Medicaid is vital for families facing long-term care decisions, especially as loved ones age or need support. Earlier, I mentioned that Medicaid and TRICARE oftentimes allow for what's called dual eligibility. You will find that what's much more common is dual eligibility between Medicare and Medicaid, where as individuals get older and lose assets and income, Medicaid may step in to help to provide what's called wraparound coverage for those individuals. So let's talk a bit more about Medicaid and TRICARE. Some active duty members and their families may need both TRICARE and Medicaid, and dual eligibility can help, but coordination and coverage challenges may arise. And this can arise not only for the families themselves, for example, seeking to access what are called waivered services, but also can be complicated in terms of the reimbursement billing process and coordination processes between the military health system and various 50+ state Medicaid programs, because both Puerto Rico and the District of Columbia also have Medicaid programs. Family members with special health needs may depend on Medicaid waiver programs for the HCBS services that we talked about. And again, I think I've emphasized that they vary from state by state. This has led to efforts to enhance TRICARE services, including the ECHO program and the Autism Care Demonstration Initiative. Not to say that more work is not needed, because we know that all public policies and programs are about a process of continuous improvement over time. And indeed, one of the most important roles that individuals can play in information referral is understanding these programs and then also helping to get word out about their availability. I started looking at the interface of Medicaid and the military system, almost about, well over a decade ago. And a decade ago, the ECHO program had been around for a little bit of time, but was not very well known. And as time goes by, efforts to try to emphasize its role become very, very important in terms of encouraging utilization and to helping to make this bridge, if you will. Medicaid and TRICARE can be utilized concurrently. And for some military families, it's absolutely essential, say, for families that are eligible and are able to access, waiver programs. More commonly, we want to think about Medicaid and TRICARE as a concurrent aspect, as part of the continuum of care for military families. As military families separate, Medicaid may be needed for ongoing special health care through HCBS programs. Many states have adopted active duty military family friendly practices to ease access to HCBS services. Okay, let me talk about this for just a moment. And here is something I want to emphasize, that the role of the Department of Defense's state liaison officers have been playing, and that is trying to encourage states to change residency requirements that have created an impediment for military families to access waivered services, especially as they transition from the military. Now, you can see the site here to Military OneSource, and basically what it does is that it takes you to the state policy tracker page that Military OneSource hosts. It's a really, really helpful resource, everybody. And we have a link at the end of the presentation, and I encourage you to take a look at what's happening in each of the states. Currently, there's about 30 states that have adopted policies in one way or the other aimed at trying to help families preserve their eligibility to apply for waivered services even if they move out of state. So, for example, if I am in New York, the idea is that I can preserve my eligibility to apply for a waivered service, even if I'm PCS and I leave the state for a number of years, a couple of years, and then come back, okay? There has been widespread recognition that families have been disadvantaged because it's been difficult for them to establish and maintain residency in a state because of the PCS process. And because they've moved, they've lost their place in line, if you will, to receive waivered services. This is very complex, and I don't want to say that eligibility means that you will have access or coverage because people wait many, many years. But one impediment that has been out there is that the PCS process has essentially interrupted or created difficulties in keeping a place in line, if you will. I've just got to use that metaphor because it's probably the one that resonates the most with us. So through state liaison officers and through other efforts by the Department of Defense, as well as through advocacy community and what have you, greater emphasis is being placed upon recognizing the need to protect military families. As I said, there's about 30 or so states that have done this. And if you take a dive into their legislation and the policy, you won't be surprised that there's a lot of variation. Some states have been very proactive. Other states, it seems as if it's not quite as proactive, if you will. Some states, most states, in fact, seek to preserve the eligibility, if you will, of individuals who may be leaving the state for military service, so that when they come back to the state, they still have maintained their eligibility and, quote unquote, their place in line. There are a few states that have actually sought to be more proactive and to extend eligibility to newly arriving families, okay? But this too has its own complexities. And the idea is that individuals moving to a new state would be given preference or given a place in line, if you will, by moving to a new state if they are in the PCS process and they are serving in a new duty station. These are not quite as common as efforts to preserve eligibility. Chris's big takeaway is that over the course of the last 10 to 12 years, more and more is being done at the state level to try to accommodate the needs of active duty military families, either PCSing or transitioning out of the military to try to provide or to keep their place in line to receive waivered services. But with that said, these Medicaid waivered services are often in short supply. And so these are important steps, but they're not all the steps that need to be taken. So let's move now to some of the barriers and access to coverage. You know, laws and policies alone are not enough. Awareness, knowledge, and attitudes affect service access. Think back to that social determinants of health chart that I showed you from the Kaiser Family Foundation earlier in this presentation. Think about things like stigma. Think about things like health literacy. And by the way, folks, health literacy is not simply literacy of the patient or their caregiver. Health literacy also refers to us as folks who provide expert information, who provide information referral. And health literacy also relates to the healthcare providers themselves. And so one of the things we want to do is we want to try to break down these constructed barriers that we have to accessing care. And so, for example, some of these policy changes at the state level are a good example of that, trying to break down these legal barriers to access. But we also need to recognize that, for example, that sometimes there's negative perceptions or stigma attached to receiving Medicaid. I always tell folks, Medicaid is an insurance program. It's not welfare. It's an insurance program. And it's an insurance program that is focused on those who have health needs. And it's an insurance program that's focused on those who may be low income. As noted previously, states are increasingly responsive to military family needs during PCS and separation. Still have further to go down the road, no doubt about it, but they're increasingly responsive. Here's a big takeaway. In 41 states, Medicaid eligibility has been expanded to allow for more low-income adults with or without dependents to be insured under Medicaid. This is a game changer, folks, and this came about with the Affordable Care Act of 2010, but really did not begin to be implemented until about 2014. So we're about 10 years in. And we see that 41 states have broadened enrollment by allowing for what is called Medicaid expansion. Well, wait a second. I mean, 41 states out of 50? Yeah, because we know that Medicaid is a state and federal program. And so it's at the state's discretion whether or not to expand Medicaid or not. And essentially, in those states that have expanded Medicaid, individuals with or without dependents, adults, can earn to almost 138% of the federal poverty level. In other words, have low-income jobs and receive this health insurance. Now, it's not unrealistic to think that some of our folks who are exiting the military or their family members may be part of this expansion population. It is interesting to note that some states with very high active duty military and retiree populations, including Tennessee, Texas, and Florida, have not expanded Medicaid. But other states like Virginia, West Virginia, California, well, I could go on, have expanded Medicaid. It's also important to note that recent Medicaid state waivers have now started to target the overall economic well-being of individuals. And so there's a new set of Medicaid waivers that are coming forward, some focusing on specific populations, such as in Arkansas, where economically vulnerable veterans, especially younger veterans, are able to qualify not only for Medicaid covered services for healthcare, but also supports for housing. And this is happening in both blue and red states, if you will, in terms of we talk about politics so much these days. But both conservative, liberal, blue, red, you name it, states are adopting a more bipartisan, pragmatic approach to health promotion through prevention and management. And so again, just as we think about home and community-based services as just something that we do, we think about managed care as just something that's common in the way that healthcare is organized in our country. These were products of Medicaid, in large part, not exclusively. The focus on utilizing supports to help those who might be vulnerable, like newly separated veterans, in some of our states, and providing health care and perhaps housing, perhaps food supports through Medicaid, is another example or illustration of how Medicaid has become sort of this platform to provide insurance and support for those in our country. Challenges persist. And as we wrap things up today, always remember that eligibility is not necessarily coverage. Limited availability can mean waiting lists, for example, for like HCBS waiver programs. It is wonderful to try to preserve individuals' eligibility, but that does not necessarily translate into coverage. And that's still a big friction point that we have. We need to find more robust ways to help families who have members with specific or special health care needs. Coverage is not access. There are many factors that complicate accessing services. And so those of you who are familiar with healthcare systems, whether it's TRICARE, whether it's your own healthcare system, whether it's Medicare or Medicaid, we oftentimes understand that it's difficult to coordinate scheduling and the logistics to make appointments. State variation will always continue and does continue with Medicaid. And I hope that's been a big takeaway. Wonderful starting out this morning and thinking about folks from all across the country, but also recognize that each of your Medicaid programs is different. They talk to each other and they work together. There's no doubt about it, but they are different. And healthcare is complex, and there's no doubt about it. Trusted intermediaries in the military family readiness system, like you, are crucial for information, referral, and guidance. Just to bring it all home, we know that Medicaid offsets health costs, improves families' economic status and ability to afford essentials like food, energy, housing. It helps Medicaid helps healthcare providers identify, diagnose, and address health conditions. And we understand that a social determinants of health approach supports more coordinated, comprehensive approaches to family security and well-being. Take out the word Medicaid. Think about security and well-being. What role do we have to play in promoting that with those that we work with in the military community? You all do it every day. As we go forward with the Military Family Readiness Academy, I think we're going to be given the opportunity to look how we're addressing this from many different angles. I would stress too that Medicaid has been a bellwether for new approaches and it will continue to be. That we need to continue to improve the connections between Medicaid and the defense health system. It's not so much a criticism, it's just the acknowledgement of two highly complex systems that need to work together, especially at various key points in a service member and their family life cycle. I know it's all small print here, but Rachel has been kind enough to put all these resources and the PowerPoint in our resource thing. I highly encourage you to take a look at these resources. They're just a wealth of information. So I want to thank you all. I know that we're done with time and I've gone over a little bit, I think, but Rachel, I'm going to turn things back to you.
Great. Thank you, Chris. I appreciate today's webinar. Thank you for everyone that's been on and stayed on. I think this is really going to set the stage, especially as we kick off the Economic Readiness and Military Family Wellbeing series. But before I briefly talk about that series, I wanted to share our CE information and certificates of attendance. Please make sure that you go to our event page. I've posted that link again in the chat for all of our CE info, our copy of our slides and resources are on that event page. Please go down to that section. There's going to be a nice purple button that says Continue Education. Make sure you complete the evaluation. Once you complete your evaluation, you're going to be able to select which CE option you are interested in receiving. Maybe you want all of them. That's okay. We will take it. So please make sure you complete the survey first before you select which CE option or certificate of attendance that you're looking for. And those are going to be delivered to you via emails. So those certificates will be directly emailed to your email that you provide in that survey. Coral has also posted a direct link to the evaluation as well. So make sure that you access that to receive CE information. Also, if you have any questions though with receiving your automatically generated certificates, please email us at ce@oneop.org and we'll make sure you get those as well. I'd like to take your attention, though, to a big event that's happening for OneOp throughout the month of August, and then it's kicking off as well into September. But um, starting this month, we are focusing on economic readiness and military family well-being. And Dr. Pline's presentation on Medicaid just really set the stage as we go into this series for the Military Family Readiness Academy. And so over a course of 6 weeks, OneOp is going to deliver a series of professional development opportunities focused on economic security and family well-being, including an on-demand course that's now available in 3 webinars. And the series is essentially going to equip service providers with the skills necessary to support family well-being while navigating the terrain of economic security for military service members and families. The on-demand course that's available is going to provide that foundational primer to economic security and family well-being for professionals. And the webinars in the series is going to frame economic security through the lens of emotional, physical, social, and financial well-being by exploring programmings, discussing any gaps in services, and investigating ways to better link families in need with services. So please get connected with us. The Academy will also detail programs available to military families through cooperative extension service that are aimed at increasing economic security. So please note the courses and webinars in the series are free and open access to the public as well. So I have posted that link in the chat for everyone to get connected to, register for, and start joining us on those online courses, and mark your calendars for those webinar series that are happening. So we are going to stay on for about another minute so you can gather those last minute resources. Again, thank you for joining us. Thank you for attending. We're so glad to see folks from all over in your different areas of expertise. And Dr. Pline, we greatly appreciate you as well and your expertise in Medicaid and healthcare policy. So I see there's a few comments about having issues accessing the purple button. So I'm going to include the direct link to the evaluation in the chat. So that direct link. So if you're not seeing the purple button, don't fret. I provided a direct link to the survey in the chat as well. And then if for any reason you have any tech issues or you need some support on your CEs or certificate of attendance, I've also posted my direct email. So feel free to reach out to me, and I can help you there as well. All right, we're going to go ahead and begin to close out. Thanks again, everyone. Hope you have a wonderful rest of the day and a great week.